Welcome back to our suturing video series. This technique is illustrated by the brilliant Roshan Patel and moderated by George Stratos. You will now pause the video and observe the diagram closely. Here you will observe Roshan burying the knot. First, place a buried knot at one end of the incision. You typically go deep to superficial on one side, as illustrated here, then superficial to deep on the other side, and tie your knot so that it's buried underneath the skin surface. This keeps it nice and concealed. Here you see Roshan tying the knot, whilst maintaining its concealment. After you do that, as you'll see now Roshan moving on to do, you insert the needle into the dermis on one side at around a 10 to 15 degree angle. Then exit within the dermis on the opposite side, about 3 to 5 millimeters ahead along the incision. Keep your passes parallel to the epidermis. Ensure you capture the dermis without breaching the suture, the surface. The suture line should look like a zigzag or railroad track beneath the skin. Roshan is starting to do this now. Observing this video. He now properly buried the knot, and now he's starting the technique we talked about, of the zigzag or railroad track pattern beneath the skin. And as we said, do this at a 10 to 15 degree angle, and at about 3 to 5 millimeters ahead along the incision. This video is now sped up to show you Roshan going along the incision. Insert the needle, as we said, into the dermis at 10 to 50 degrees angle, and that's quite important, as you see demonstrated here. Pull the scissors snug after each pass, but not so tightly that you cause puckering or compromise blood supply. Aim for a neat approximation of the wound edges. The subcuticular approach helps hide the suture line and reduce track marks on the skin surface. That's why it's commonly used by plastics. Try to pass the needle at the same depth in the dermis each time. Inconsistent depths can lead to uneven wound edges or a bumpy scar. If you see the skin blanching, loosen up. We want approximation but not strangulation of the tissue. Subcuticular sutures naturally provide good eversion, but if the tissue is prone to inversion, consider adding simple interrupted sutures at intervals or using steady strips to help reduce and distribute the tension. When you reach the end of the wound, as Roshan did here, finish with another buried knot, or alternatively, secure the free end of the suture with a steady strip on the skin surface. In practice, many surgeons choose an absorbable suture and simply cut it flush, letting the knot remain subcutaneous. Here, Roshan will attempt to bury the knot and observe his technique closely. Observe the way he is tying the knot. Brilliant. And there you have it, a neat, continuous subcuticular closure that balances form and function. Always check local trust or hospital protocols for suture choice and removal guidelines. Thank you for watching, and this has been your Surgeon.